My name is Carrie Allen, and I am a consultant pharmacist. I'm here to talk to you today about the 5 elements of a great med pass. If you pass meds, you know that there's a lot more than 5, but these are the 5 major basic areas that you should be concerned with when someone's watching you do a med pass, but also just on a day-to-day basis. When you're going, we're going to go through some PO, some per orum medication rules, and these might seem basic, but let's just bone up on these a little bit. You're going to clean and disinfect that work area, that med cart, and you may have to do that several times during a shift. You're going to ensure that all your equipment you need is on hand, including your water and your med cups and your spoon, etc. Perhaps you might also need a med crusher with the little med crusher pouches. That is an important tool to have. Make sure that you have a blood pressure cuff. Make sure you have a place to write down your vitals, those kind of things. Do you have the vitals related to the med? Are they applicable and desirable? Did you do an apical pulse for digoxin? Digoxin generally requires an apical pulse, and not all people know that. Blood pressure meds. Is the blood pressure too low? Is the heart rate being affected? Are we doing orthostatic blood pressure checks? Do we need to? Is the resident alert and acting normally? If you go in and, resident Polly is just not acting right, go get the nurse, or if you're the nurse, do an assessment before we start giving people medications. Wash your hands before setting up the med. You could possibly use sanitizer if that's appropriate as well, but make sure hand washing is in there somewhere. Prepare the right med at the right dose at the right time. If it's crushable, you need to know it's crushable. Make sure you have a crush order first, and keep a list in your MAR book about which meds are or are not crushable. Call the pharmacy if you have any questions. You want to crush things into a fine powder, not into the jagged edges. Don't touch meds with your hands when you're going to punch them out or when you're taking them out of the pouch when you're crushing them. So, for example, you have a med cup. We've all seen those little med cups. I see a lot of this. Sometimes people are, just thinking I'm not watching. Oh, look, I touched it. That's gross. Don't do that. What you want to do is make sure, you've got the right med, the right dose. You're going to position it right over, and you're going to push it out. And there you go. As time goes by, you're going to get more proficient at that, but you're also going to get busier, and you're going to make mistakes. Now, I didn't touch that med. That's great. I'm going to take it to give to the resident, but what if I have 5 or 6 meds or different things going? Should I stack things on top that maybe have touched the bottom of other carts and just carry them all into the room? No, that's not sanitary. So what you're going to do is make sure that nothing else touches it, and you're just going to carry it like so. If you're wearing gloves, that doesn't protect you from everything. Still don't touch people's meds. Okay. Now, check that you have the right med at the right dose and time, and make sure that they're not expired. Every time you give a medication, you should check to make sure that it's not expired, especially PRN medications. Those go expired before we know it. Lock the med storage area while meds are given, and you want to keep those keys. I'm going to hit that key thing hard. Don't leave those keys around. Identify the resident. Ensure it's the right person. If the resident likes to hold the meds in their hand, some of them, they like to hold them and they like to count. Do I have 5 pills? I always take 5 pills in the morning. Make sure that their hands are clean. Explain what meds you are giving and why. Always explain the reason for the meds or any treatment or procedure. It's important that you know, and it's important that the resident knows. Ensure the resident is correctly positioned to prevent choking. You may have to rewash your hands because you're touching people. Use those gloves when you're touching people. Administer meds by the right route of administration, and make sure that if you're setting medications or creams or anything down on that bedside table, that you've cleaned that bedside table. That's probably not very sanitary by the time you get in there. Always encourage water or fluids. I get a lot of, well, she only drinks, this, or she'll only drink maybe a couple sips. Well, maybe that's true, but you want to encourage that all the time, not just what you think they usually drink. Try to get them to drink more. Older people are chronically dehydrated. Everyone these days is practically chronically dehydrated, I think. Watch that person. Wait to ensure that all meds are swallowed with no issues. Are they going like this after you gave them the big potassium pill? Is it burning? Because that's not a good thing. That potassium can literally burn a hole in your esophagus if it sits there long enough, especially if they've had other issues, and in your stomach. Make sure there's some water, it's going down. Are they coughing or choking or clearing their throat? Are they complaining of reflux? Make sure they've swallowed all those things. Dispose of your supplies after you're done. Wash your hands after giving the meds, possibly using some sanitizer. Are the residents' hands now clean? Did they touch their mouth and get slobber all over it? Wash their hands. Document immediately after giving the meds, or you could chart by exception. I'm not going to go into great detail, but that is also acceptable, where you would just initial everything as you pull it out, and then you'll go back and circle and explain thereafter. Those are both acceptable per the state operations manual. Double check those MARs before you move on to the next resident. Ensure you gave all those meds and that you initialed them. If you didn't give it, circle it, and then on the back, document why you didn't give it. Note and report any issues either to the nurse if you're the med aide, or to your superior, or to the doctor if you're the nurse, if you had any issues with the pass or maybe some unusual responses to the meds.